All right, now we're live.
Terrific, thank you. And so thank you all for being here. Our goal today is take a look at the Budget Adjustment Act and how it may be affecting divisions or departments within AHS. And when we started talking about doing this last week, the BAA was over in the House. Now it's probably going to be expeditiously taken care of in the Senate. But it's important for us, I think, to be brought up to date on the requests that have been made by the agency. And we have looked at at least I have looked at some of the recommendations that are being made. So why don't we just dive into the testimony, and I would like to first, thank DCF and Dale for taking time out of your extraordinarily busy days to be with us, and we greatly appreciate it. So Commissioner Brown, I'll let you kick it off and help us understand. I don't think we have any testimony from you on our webpage. Is that right?
Correct. And so I was hoping with me today, for the record, Sean Brown, Commissioner for the Department of Children and Families. And with me today, I have Sarah Truckle, our Chief Financial Officer. And we were going to put the ups and downs up on the screen if Sarah could be given control to do that. And then what I was, if it works for the committee, I was just going to focus on the policy or substantive areas of the BAA that impact services or implicate services or caseloads, and kind of shy away from any of the technical pieces of money movement or net neutral things, unless they impacted positions or something to that effect, if that works for the committee.
Nope, that's terrific. Thank you.
Okay. And so I'll just jump right in, starting with the DCF admin and support budgets. A couple things that I would highlight here in this depth ID for the committee. As we've testified throughout the fall regarding the closure of Woodside and our work to stand up the new secure residential treatment program in Newberry and working with Beckett. And then also looking at implementing the Families First Services Prevention Act. We thought it was important that we retain a position there and create a clinical services director position for the department that will report to the commissioner. And here you will see that position moving from the Woodside depth ID to the admin support ID for the commissioner's office here in DCF. And so we're excited that we're going to be able to have this new position and already working, in terms of their responsibilities and oversight of our residential treatment of kids, and then also other services as well. And then the other area I would just touch on here, as we did see an increase in federal revenue to the base block grant in the CCDF block grant of $660,000. And those dollars right now are being purposed to help build out the first module of the Bright Futures Information System, our IT system that supports the work of the department and our providers who do the eligibility and referral work. And so we're hoping that that first module will be online and functionable by October 1st of this year.
Is that the integrated eligibility system?
No, this is a different, system.
Okay.
IE&E is the healthcare and the big financial benefit programs and economic services. This is its own standalone system that's being built out module by module. But we're hoping the way they're being built that we'll be able to interface and connect pretty seamlessly with all these other systems that are being developed as well. So,
okay, thank you.
Those are some of the fundamental principles of as we build out these new systems to make sure that they, share data and information as seamlessly as possible across our programs and departments.
Okay.
Moving on to the next depth ID, the Family Services depth ID. About 3 or 4 things to touch on here. One is we are moving a position, and it's incumbent that was working in the Family Services division. She previously had worked in the Child Development division in leadership there as well. And throughout the summer, as the Child Development division was asked to implement the series of relief programs to support the childcare system and the hub system. We borrowed this position and individual to support the work of the division, and it worked really, really well. And so we see a long-term need with the new stimulus money coming. And so we're moving that person in their position from family services over to the child development division, with the understanding that once we have a vacancy elsewhere in the department, that we will replace the position that we are moving from the family services division. The other thing I would highlight, we are seeing an increase in adoptions, and so there's increased pressure on that caseload and the payments we pay to adoptive families to support the children they adopt. And so you will see an increase in the budget just to support that increased adoption caseload that we're seeing. The next piece of the Odin and Turtle Rock funding, these were mental health crisis beds that the department has contracted with Washington County Mental Health to stand up. Some of it was in response just to a need, but also, you know, when Woodside was opening, we were seeing kids being placed there that really had higher levels and different needs. And so these beds were created to help better serve those kids, and also respond to a settlement agreement with Disability Rights Respect to Woodside that was filed in the U.S. District Court. When these beds were created, they weren't in the budget. And so now that they're playing an important and ongoing role in our system of care, we are now having them be a separate line item and budgeted, because they have not been, and we've been covering them at closeout in other ways. And so this just rolls them into the budget moving forward. The other is a new initiative here, Raise the Age, Justice Involved Youth. This is for 18-year-olds currently that are now being referred to DCF instead of being in the adult system, correctional and probation system. Those 18-year-olds, for many, except for the Big 12, are now referred to DCF. And that law became in effect on July 1st. And what we're seeing is there's a number of 18-year-olds who really need a higher level of service than available, particularly around housing and getting connected to other services and providing some level of guidance and supervision. And so we're proposing to go out and through an RFP, a request for proposals, to find a provider to create some transitional housing support for these 18-year-olds that we're seeing who need this level of service. So it would be some transitional housing with support services embedded in it. And so this would start this quarter, and in the governor's recommended for 22, you will see the full year cost of that, which is just under $500,000. So we want to get this going as quickly as possible. Any questions on so far what I've?
I do have some questions. I was gonna hold mine till the end, but does anyone have a burning question right now? Just speak up, because I can't see everybody.
Okay, Madam Chair, I have a question. This is Senator Hardy. Commissioner, the Raise the Age Justice Involved Youth Housing that you just mentioned, and then I'm having a hard time seeing your spreadsheet, and I don't have the language of the budget adjustment in front of me, but would this funding or either of these two things that you just mentioned, would they have potentially helped to prevent the situation of a justice involved youth being in a hotel room with a social worker and the incident that just occurred related to the sexual assault?
So this is for a new population of emerging adults that we're now serving in our system of care. Up until July 1st, we only served under 18-year-old and below for youth. With the Raise the Age, with the justice involved youth, we are now serving 18-year-olds. And then on July 1st of 22, 19-year-olds will now move into our system of care unless they've committed one of the Big 12 offenses. And so what we're seeing as we have experience working with this new population, we're seeing some gaps in services for that population. What you're referring to, I think, was a younger youth in our existing system of care, our residential system, and the impact the pandemic has had, and just also the challenges of responding, to events in the middle of the night and transport issues. In terms of what you're referring to there, I mean, we're working hard and to develop some new supports in place to prevent that unfortunate situation from happening in the future. Moving forward, we're no longer going to staff youth in hotels and are developing supports to put in place so that youth are better served. And also we're not placing staff in difficult situations as well.
Okay.
So sorry, go ahead. Go ahead.
I was gonna say, well, that's obviously good to hear, but it sounds like these are two different populations, but that there's insufficient beds potentially at both levels, age groups, the younger youth and this sort of transitional age.
Yeah, so this is a different population, but to address the specific concern that you're raising, we contract with a multitude of residential providers to serve our justice involved youth and our CHINS youth in the child protection system. Actually, the bulk of children in residential are actually from the CHINS side. And so we use in-state and out-of-state providers. What we're seeing right now is that COVID is having an impact on how we access those programs and also how they're being staffed. And so with the new health and safety protocols, and if staff tests positive, it's really impacting our ability to move children to appropriate settings depending on what's happening at any one time in response to the pandemic. And it's also created some challenges, working with our sheriffs and transporting youth at all hours, given that they're being spread very thin, helping provide security at the over 70 hotels that we're using to provide non-congregate housing to homeless families right now. And so we've been leaning heavily on the Sheriff's Department in a multitude of areas. And so we are working to make sure that we have the ability to transport youth at all hours of the day and the evening when needed. And then also that we have other systems in place when we can't access our residential system of care, just due to staffing and other issues that we're experiencing in the pandemic right now. And so, the leadership team at FSD just submitted a proposal to me last night on what that will look like. And so we're going to review that and then figure out how we can quickly implement that to address the concern that you raised specifically, Senator.
Okay, thank you, Commissioner.
Yes, I want to stay with that, with the Raise the Age. It's a new program. These are justice involved youth. Have they been adjudicated?
Some of them could be adjudicated and some of them could be also still in the system and refer and having their case adjudicated, but that they could be referred to us for services pending that adjudication, Senator.
So I guess then the question is, what is the language that will be in the Budget Adjustment Act? And we'll have to look at that, because that is there may be some significant policy implications for that going forward. I mean, this might be a stopgap provision. You've got, is it a new position?
Yeah, this would be a service that we would go out to contract for, to work with a community provider to provide the transitional housing support and the case management and other support services.
And there's not, and there's, so I guess the juggling act that will have to happen in appropriations around funds available within the DOC, DCF, and the judiciary, and how, I mean, I'm thinking about some of the work that we're doing already. So it'll be interesting to see what the full budget recommendation is on this. That, yeah, I mean, the other question I have related to this, when you're talking about the 18-year-olds coming into the system now with our new legislation, that also raises a question that I have had, and I'm been working on related to foster kids and the cliff that they meet when they become 18. And so we'll have to talk about that another time, but and it includes some of their healthcare issues as well as housing and being able to stay with family.
Yeah, and we're happy to connect with you and have that conversation.
Good.
That is an important area to focus on for sure.
Okay.
Senator Lyons, if I may.
Yes, ma'am.
Thank you. Commissioner, I know that, the transitional housing is an issue, the availability of transitional housing, and I'm just curious to know if a fallback is in trying to provide this type of housing in a very timely fashion would be hotels.
To be honest with you, we have had youth that have been referred as 18-year-olds to our system as adults, as an 18-year-old adult, and that given they didn't have family in the state and there was not another transitional housing, that they were housed independently in a hotel until other housing. They weren't staffed, but that they were provided services and people visited and connected and made sure that they were getting connected with the community providers to meet their various needs. And I think that, seeing that experience this summer is what led us to develop this, that we really do need to make sure that all of our emerging adults who are interacting with us under Raise the Age are getting access to the appropriate housing and support services, because some of them don't have the family connections where that they can reside with a family while they're working with us to address their goals, as they move forward into adulthood. And as a piece of this, also, our work with Beckett is also focused on that. They've shown a willingness as we're developing the new secure residential treatment program. Historically, Woodside only served, up to 18, and after that, we didn't have a system in place. And so while there's no agreement in place, we have had conversations with Beckett, and there's an openness on their part. I think there's a lot of work to do in this area still, but to have Beckett possibly serve Raise the Age kids that might need that level of service as well. But I think, we need to first, build the program, develop it, and then as we get experience running the new program, see if we can't expand that to 18-year-olds if it seems like the right thing to do and it's the right fit.
So, and as you're talking, I've had a lot of emails from people who live in the Wells area of the state near the new facility, and we're going to have to we'll have to bring you in to talk about that at some point and what the programming is going to look like. So
I'm more than happy to. And also
Okay.
I know one of the just to touch on it, I know when the Joint Fiscal Committee took the recommendations from the Joint Justice Oversight Child Welfare Protection Committees last year, community engagement was an important piece of that. And we do have a community forum scheduled for next week. With
good.
Beckett
I
and the
said
state
that
team.
I said there might be one. So
Yeah,
I was hoping there would be one.
Yeah, so
All right, we'll come back to that one, but thank you.
yes. Moving on to the child development DEPT ID. Here you will see, as we saw the position leaving the Family Services Division, you see it coming into the child development DEPT ID here. So, and then the other thing I would touch on, and I think when we provided an update, childcare update to this committee last week, we touched on we're seeing underutilization in the subsidy program. We're at about 75% of pre-COVID utilization. And so we're seeing a 4.8 underspend in the program, and you'll see that here. I would point out that, in the governor's 22 budget, in the creation of that IT fund, the remainder of the build out for the Bright Futures Information System is included in that, and that cost is approximately almost identical to the $4.8 million underspend here. So in a way, we're seeing these dollars being reinvested back into, at least for the IT system, in the future when we're at a position to be able to complete that build out. And then moving on to the next step ID that with some substantive changes would be the general assistance budget. Here, just for the refresher for the committee, one of the components of the general assistance program is we have a burial program for low-income Vermonters who die and are not able to pay for their burial service, either through a burial or a cremation. And we are seeing increased pressure on that. The benefit maxes out at $1,100 per individual. And so, you know, you're seeing here, we're seeing an uptick of around 230 cases, upload caseload pressure of Vermonters dying and needing to access this program to help pay for their burial service. And then the other piece here, you'll see the non-congregate housing. We are still in our public health response, housing almost over 1,900 households in motels across the state to keep them safe from the pandemic and so that they can isolate. We are, up until recently, we were drawing down 75% FEMA money for the match to pay for that. And then the state had to come up with a 25% match and we were using CRF. Here, the interdepartmental transfer is really giving us a spending authority to draw down and spend those FEMA dollars. We did receive news recently with the new administration in Washington that they are now going to reimburse the state at 100% of those costs. And so it was just too late to reflect that in this budget adjustment. It happened after the fact, but that's good news for Vermont because we're spending just about $5 million a month on motels right now across the state to keep homeless families safe during the pandemic.
Can you, I want to give Dale sufficient time to talk, and I'm very interested in the Reach Up caseload savings and what's happened there, whether that's been reinvested. Can you shift to that one?
Sure, that was the next in line for the Reach Up Depth ID. Yes, so we are seeing a caseload reduction, in the restatement budget based on, what we thought we would see based on our experience in past economic downturns. The Reach Up caseload would go up, and we put in an up of 5 million, I believe approximately 5 million in general fund and about 5 billion of CRF funds. We actually are not seeing the caseload increase like we anticipated. It has actually dropped. We are down about 650 cases where we were at the start of the pandemic, in the April timeframe. And so we're still trying to understand the impact the pandemic's having on families and the general economy. Overall, our applications are down about 16%. And given this was an up in response to what we thought would be an upward caseload pressure, we are booking these to go to the bottom line of the budget, and they have not been reinvested given this is the budget adjustment.
So in terms of the caseload savings, the recommendation to use those is, that's a question. What is the recommendation for the use of caseload savings?
Well, at this point, given, we had booked that increase in the restatement in response to what we thought we would see for a caseload increase. We have not seen that increase, and we have provided additional financial relief to Reach Up families. We provided the 1.3 million at the end of December, and then we provided a 1.3 about a month and a half earlier than that. So we have been supporting Reach Up families as well, and many of the program requirements have been suspended in response to the pandemic. And so we're not seeing some of the normal costs that we would see in response to the caseload, given the way that we've suspended many of the program requirements at this point. So we're certainly to have a conversation if there's interest on the legislature's part, we'll provide an analysis on benefit levels and if that's a direction the legislature is looking at. I know in the past we provided a lot of detailed analysis. It's complicated how the funding mechanism works for the Reach Up benefit. There's the base year that we use for the financial, then there's the rateable reduction, and then there's the housing allowance as well. So it's a very complex mix of how the benefits are calculated.
So, I think given the time that we have and the state of the Budget Adjustment Act right now in appropriations, I think I'd like to shift over to Dale, unless you think there's something burning that you'd like to bring up.
Yeah, the only thing I would point out is in the Woodside Dept ID, we do have a $2 million up for the remainder of the renovations for the Beckett facility. We did put 1.2 in the restatement budget, and it's looking like the renovation costs and working with the architects and BGS is going to come in around 3.2 to 3.4 million dollars. And so this just allows us to move forward with those renovations to that facility.
Okay, and we'll, as I said before, I think we might come back.
Sure.
We'll come back to this one, especially around programming and who's going to be there. I know that's still an outstanding question. I think it is. Yeah, so, okay.
Yeah. Happy to have that conversation.
All right, good. I'm sure other committees are already engaged in that. All right, thank you for the quick overview, and we'll have you back in as we look at the budget, and we'll also be looking at additional federal funding that's coming our way, and our goal is to try to understand what the guidance is and how it's going to be utilized. So we'll be working together again, I'm sure, on that.
Yes, it's certainly a dynamic funding environment on the federal level right now, for sure.
Dynamic's a very good word, isn't it?
Yeah.
Okay. Thank you. So committee, we're gonna just move right ahead. We have the Commissioner of Dale here and others, so I'd like to get into the recommendations in the Budget Adjustment Act. And I think, why don't we say welcome, Commissioner Hutt, and also congratulations on a new appointment, and we're going to miss you.
Thank you very much. For the record, Monica Hutt, I'm the Commissioner at the Department of Disabilities, Aging and Independent Living. And with me is, Megan Tierney Ward is on video. She's trying to get her computer fixed. So she's dragged herself to Waterbury this morning to try to figure that out. Megan is our Deputy Commissioner. And of course, Bill Kelly, who's our Chief Financial Officer. Thank you for the congratulations, Senator. I suspect that you and I will be talking a lot more in the new role as well. And I am grateful for the opportunity. We do have, I believe you received a budget testimony document for our budget adjustment. I'm happy to share my screen as well, whichever is easier.
Yeah, that's good. And we do have your testimony.
Great. So let me do this. Are you seeing the testimony document? Great. Okay. It's always, you always want to check. So just because there are lots of new faces to me on Senate Health and Welfare, welcome to all the new senators. I'm looking forward to working with you. I thought it might be helpful to start with just a really super quick overview of the department. So then some of the conversation about the dollars will be in a little bit of more context. Is that okay to do? I can talk pretty fast.
It is, and just so you know, and we will have you back in and we'll do formal introductions at that time. We do have another topic coming up at, let's say, 11:35. It's scheduled for what, 11:30. So that's the timeline.
Okay, I will talk really fast then.
Okay.
And you can certainly look at this at your leisure, but really just the first few pages just walks you through both our mission statement around older Vermonters and Vermonters with disabilities to ensure that folks can live in Vermont and make this the best state in which to grow old or age, live with a disability, and walks through our 5 divisions. So the division for the blind and visually impaired, the adult services division, the developmental disability services division, the Division of Licensing and Protection, which is our survey and certification unit and adult protective services, and finally the Division of Voc Rehab. So there is lots more information that will come to you about those. I won't take more time to talk about our partnerships in the community, but we'll have opportunity to do that. So the next page of the testimony aligns with the ups and downs that Commissioner Brown was just using. So that larger budget document, we take the numbers from that document and we put them into this format just because it's so much easier for me to talk from and hopefully easier for you to read. But it does map to the ups and downs, just so that you know that. So the very first section is an overview for the entire budget adjustment. So those first 4 items in the overview section are really the 4 things that I'm going to speak to you about in different appropriations. And just from a global perspective, it's important to know that of those 4 items, 3 of them are totally budget neutral. So they are just shifting spending authority or moving dollars around, but they're budget neutral. The only ask is specific to the collective bargaining agreement, and I will talk about that a little bit more. So moving again, so these 4 items are reflected in specific appropriations. So the first appropriation is in the Dale administration section. And that administration, and you'll hear about this when we do our budget testimony, but that appropriation, the administration holds all of our salaries across all 5 divisions. And the only item in budget adjustment in that is backfilling some unallowable CRF indirect costs. I suspect that you've heard this from other departments already. There is that CRF guidance was a moving target throughout the entire pandemic. And so I think that the agency is continuing to try to manage that appropriately. So this is a cost neutral, budget neutral shift, just moving dollars around with the CRF funding. And in this instance, DOC received the CRF dollars, and we needed the general fund to come back into the department, but neutral across the agency.
Okay.
So I'm going to walk through all of them and then maybe pause for questions at the end so I make sure to get through. The second appropriation is our Dale grants appropriation. That appropriation covers the funding that we give to the area agencies on aging, our attendance services program, the home share grants. So our grants for older Vermonters or adult Vermonters. 2 items in that section. The collective bargaining agreement. The state of Vermont has a collective bargaining agreement with the independent support workers. So it's a union of those independent support workers that are hired by families or hired by individuals to provide personal care services, respite. They are employees of families or employees of individuals with disabilities or individuals in our Choices for Care program, but the state holds this collective bargaining agreement with those independent support workers. That agreement is renegotiated every 2 years, and what you see here is 6 months. So for the remainder of FY21, an increase in the collective bargaining agreement for those independent support workers that are providing services in the attendant services program. You'll see that same CBA item come up in several other appropriations because those independent support workers are split across different programs. So this is reflective of just that attendant services program in this particular appropriation. And then the second item is, again, it's a budget neutral, shifting spending authority from the agency level to the department. It's a funding for the SASH grant. Dale holds a grant with SASH. There's a certain portion of dollars that come to us for the next 3 years. This is year 2 of 3 years that need to come from the agency to Dale to continue to fully fund that SASH grant. The next 2 appropriations are the Division for the Blind and Visually Impaired, and there are no adjustments in budget for that for FY21 in that appropriation for that division. And there are no requests in the vocational rehabilitation appropriation for this budget adjustment. That brings us down to developmental services. And again, you see that collective bargaining agreement for the independent support workers, the raise to the floor of their salaries for those individuals that are providing services to folks with developmental disabilities. That's the collective bargaining agreement. It's 6 months of this fiscal year, the change in that collective bargaining agreement. I'm trying so hard not to use acronyms, but I can feel myself saying the same words over and over again, so I'm sorry. We call it the CBA, but I want to make sure not to do that to you. In the traumatic brain injury program, that's another appropriation. There are no adjustments. You will hear us talk as we do our budget testimony that we are actually trying to change that language to brain injury versus traumatic brain injury, recognizing that some brain injuries are not the result of blunt force trauma, which is what traumatic refers to. So it's more inclusive of strokes or things like that that could also create a brain injury. So it's just a change in language as we recognize that the diagnosis has changed a little bit. We'll talk about that program more in our budget testimony. And then finally, in the Choices for Care appropriation, once again, you see that collective bargaining agreement, that CBA, and that is for the independent support workers that provide care to families and individuals and are hired by those families and individuals in the Choices for Care program. So that portion of dollars for 6 months there. And then the final item is, again, a carry forward from state fiscal year 20 to 21 in the Choices for Care program. It's a statutory carry forward. We just need the spending authority to do that. And so it's actually a net neutral item. Whew, that might be the fastest I've ever gone through that.
Well, it was great. And, it doesn't look like there's anything controversial. There aren't new programs in there, and the so that's very helpful. A question I have for you is, are there any policy shifts that are included in the proposal that we should know about?
No, not in budget adjustment.
Yeah, okay. All right. And then the one question that I have is with regard to Voc Rehab. And so the folks who are receiving the help that they need, with disabled and others, how are all those counselors working right now? Are they're all remote?
They are all remote, and that is a great question. And again, our budget testimony gives you a little bit of data on the last year, so you'll see a little bit of the ebb and flow. So yes, we went to all remote. That continues at this point in time. There was a little bit of a blip, I think, for sure, in terms of access to people. But, Diane Dalmas, who's our division director and has been for many years, I think has been able to articulate really clearly that we have ramped back up, and those remote meetings are happening very frequently. If somebody wants to come in person, we have tried to accommodate that if there's really no way for them to do the remote. But we've continued working really effectively with very little gap in vocational services. And in fact, as anticipated, really seeing the need for those services continue to increase because the economic job market has really changed over this pandemic. So we know that that's going to be a continued area of need. One real asset, I think, in the pandemic, and surprisingly, was that we really saw the ability to connect with youth in school increase through remote. It's a form that most kids are really comfortable with. I think that our transition counselors actually saw some really significant increases in their ability to access kids and to access school teams more easily. So some of that transition planning has been even more fluid than it had been before. And you will note in our budget, although it doesn't change numbers in any way, the budget testimony speaks to the fact that we'll be seeing some shifts in the caseworker, in the counselor ratio in Voc Rehab, focusing even more counselors on that youth transition because we see that as a need. And frankly, it's a federal requirement through WIOA. So that is a little bit of a shift. We'll keep the adult work ongoing, but really try to enhance the youth piece because it is so critical right now.
Yeah, I mean, I do have questions about that. This probably isn't the time to ask, but with regard to the EC educational counselors that are employment counselors that are out there, and how their jobs might be affected by some of this. And so and I'm thinking it's probably in the budget, and this is something that both DCF, DOL, Voc Rehab, everyone is working on, but I'm concerned that we not take our very experienced adult counselors and shift them into a school environment where they may appear to be effective, but might be less effective. And the other question I have, and this is for both you and for Commissioner Brown to come back and help me understand, but um, having a counseling going on for someone who graduates from high school and then having them go back to the high school for the counseling process, that seems problematic to me. And I'm wondering, the question is that the case? It sounds like it's the case. So I don't
Yeah,
know.
it's a great question. And we actually are working with the shift in the transition counselors so that they can work with students up until they're 25. So there's a really nice ramp into adult services. And that counseling doesn't necessarily need to happen at all in the high school. I shared with the budget committee that my daughter actually took advantage of vocational rehabilitation as a high school student, and she graduated last year. She continues her relationship with them, and that's online and through email. She's certainly not going back into any building to do that. So, but I'm happy to talk about it more. It's a great question, and it's an important, critical part of services for transitioning students.
It really is. And I think DCF has a part to play in that, or DOL, at least I know, does have a part to play in that. So
DOL and the Agency of Education, that's part of the new partnership with the Federal Workforce Innovation Opportunities Act. WIOA is an intensification of the relationship with Agency of Education and the Department of Labor.
we're going to move everything into AOE, and then we won't have to do anything. There you go. I'm concerned about it because I know how effective these programs are and what the outcomes are, and I don't want to throw the baby out with the bathwater simply because it looks like a good idea. So that doesn't have anything to do with your budget adjustment presentation, and we appreciate that. And I see Commissioner Brown's come on, and I maybe we sparked some interest. Do you want to comment on
I
this?
think it goes to your earlier comment about wanting to have a broader conversation about kids aging out of the system and making sure our youth development program is making sure kids are remaining engaged and connecting with all of the services of, that they need to continue to develop as young adults, and be stable.
Yep, we get it. And the concern on both sides of the fence, we want to make sure that the counselors who are doing the work are being respected and rewarded for their experience. And the kids then have opportunities. So we will come back to this at some point. I can't promise you when. It may be as we look at the budget. Oh, we'll see. Senator Hooker, did you have a question? You're muted.
I do, but Senator Hardy had her hand up first.
Oh, I didn't see it. I'm sorry, Senator Hardy. Go right for it.
That's okay. Thank you, Madam Chair, and thank you, Senator Hooker. Commissioner, thank you for your testimony. It was very clear. I appreciated the handout you gave us that was very legible and clear, so appreciate that. I have two quick questions because I know that our next witnesses are already here. One is, I seem to think I heard something about something in the budget adjustment related to adult day programs, but I might be confusing it with the actual budget. So I'm just wondering if that's the case, if there's anything in there related to that. And then the second thing, as you know, I've communicated with you about my concerns about the vaccination schedule in long-term care residential facilities. And now that we're in February, I just wondered if you had any update. Have all the facilities that were supposed to have been gotten their first vaccination? Has that happened? Where are we at with that? Just really quickly.
Yes, so there is an item in budget about Adult Day, and we can talk about it more when we get there, but it's the shifting back of dollars in since we had used CRF to fund them for a period of time. And yes, by the end of January, every long-term care facility that was scheduled to get a vaccine had gotten their first dose. Most of our 37 skilled nursing facilities have gotten their second dose. And we are just finishing up through the next few weeks of February, second doses for all of those residential care facilities. So skilled nursing facilities, residential care, therapeutic community residences, and assisted living. So that program got I can't think of any word more appropriate than a goose, but a kind of a push, and is working extraordinarily well. Interesting dynamics around uptake for staff, especially some of the younger LNA, LPN staff that are still a little bit anxious. So we are also working on concurrently as much education and support of facility management to educate, because that has been a little bit of a surprise. I guess we didn't necessarily anticipate that, so we're adjusting on the fly. But residents are a really high uptake, so that is all incredibly good news.
Excellent. Well, thank you so much for that update, and I'll look forward to learning more about the day programs in the budget. So
Great.
thank you, Commissioner, and good luck with your new position.
Thank you.
Oh, well, she's going to be right back with us. Don't worry. Thank you. Thank you all. Thank you, Commissioner Hutt, Commissioner Brown. Bill Kelly is here, and Sarah Truckle, and Megan
Senator-
and Tierney Ward. Appreciate all the time that you've taken, and we'll grill you next time as we go through the budget. But
Did Senator Hooker have
Senator
a question?
Lyons, can I
Oh.
just have a
oh,
request
I'm
of
sorry,
the
Senator
commissioner?
Hooker. I did not mean to ignore
Okay.
you.
That's okay. I'm concerned about the choices for care and the changes that are coming from the federal level. And I wonder if you could address that the next time you're in front of us, as far as patient portion of, the cost. And also with regard to choices for care, have these caregivers been given the vaccine? Are they part of the?
Yep. So it
healthcare?
depends on which caregivers you're talking about. So certainly so Choices for Care is a big budget. So that in terms of the community portion of Choices for Care, which I suspect is what you're talking about, Senator, Home Health has gotten the vaccine, and the independent support workers, those individuals that we talked about in the CBA that are hired by families and hired by individuals, are also all eligible for the vaccine. They were part of that 1A component that you've heard us talk about probably excessively through this whole vaccination strategy. They were part of 1A. They are working in their own areas, in their own geographic areas, to work with the hospitals. And hospitals continue to work on that 1A vaccination, in addition to having, now we've picked up the 75 plus. And so the vaccination strategy is not complex, but there's a lot of moving parts. But the very short answer to your question is yes, those independent support workers are included in the vaccination strategy and are getting vaccinated now.
Okay, thank you.
Sure.
Thank you. Thank you again.
Thank you so much. Thanks for having us.
All right, it's been a pleasure. So we will shift to our next topic, and we're going back to S42. Before we go and look at the proposal amendment that Senator Hardy worked on with Katie McClinn, we're going to pick up some testimony from Chris Loris. So we'll do that first. And then Katie, thank you for being here. And after we do that, we will look at the proposed amendment and then talk about how to proceed. So Chris Loris, thank you for being here with us. You were here last time and didn't get a chance to testify on S42. So please introduce yourself for the record, and we look forward to hearing your testimony.
Yes, and thank you, Madam Chair. For the record, my name is Christopher Loris, and I am from Rutland. And thank you for your, flexibility in allowing me to testify. So, Madam Chair, first I need to apologize for not providing written comments, but I think my testimony lends itself more to the spoken rather than the written word. But I do have some notes I could send up if you need those for the record as well. So again, Christopher Loris from Rutland, and I'm here wearing several different hats. First, as a 5-term mayor of the city of Rutland, I was lucky to work alongside my brother from another mother and current interim corrections commissioner James Baker when he was first the interim police chief in the city of Rutland and then permanent police chief in the city of Rutland for several years. So under Chief Baker's tutelage, I learned a lot about police reform, community policing, the use of data in law enforcement, the Guardian model of policing versus the Warrior model, and finally, wellness and trauma-informed counseling and its importance to not just a law enforcement organization, but to any public organization. And during that time, we worked and turned those lessons into both policy and funded programs within, specifically at this point, the Rutland City Police Department. Second hat, 7 years, I was the chair of the Vermont League of Cities and Towns Public Safety Policy Committee, where I really pushed for the adoption of some of the principles and following the pillars of the White House Task Force on 21st Century Policing. And also in that capacity gained a fair amount of knowledge, some of it unwanted, but I gained a fair amount of knowledge regarding legal exposure to and the liability of what happens when law enforcement officers sometimes and unfortunately do bad things. And for the purpose of this testimony, third, and I'd qualify as most importantly, I'm Christopher Loris's pop. So at this point, I'm going to tell you all a story. My son Christopher suffered through 8 years of recovery and relapse, with alternately being treated and untreated for, an opiate addiction, is a classic dual diagnosis with underlying mental health issues. Ultimately, after 8 years, Christopher simply couldn't do it anymore. Basically, I'd qualify it as his brain broke in October of 2019. And for unknown reasons, and on his cousin Nick's birthday, Christopher killed Nick. It was a homicide. These two young men, they grew up together. They were in the same classes. They played on the same sports teams. They were the same age, and they spent every afternoon in summer at their grandmother's home, my mom's home. Following Nick's death, Chris immediately drove to the Rutland Police Department and to the building and shot the building up, shooting up the front door with an assault rifle. And he drove away very slowly, and apparently, according to folks at the PD, he was awaiting a chase. 1.5 hours later, the police found him, the car he was in, gave chase. Christopher got out of his vehicle, he opened fire on officers, and of course, they absolutely positively returned fire. They needed to. And Christopher died in that officer-involved shooting. Again, for reasons we don't understand, as like his killing of his cousin Nick. I've been told, and I do believe that this is a clear incidence of suicide by cop. However, he certainly put the police officers at great risk, put the public at great risk. And, as I said, unfortunately, he died. And I personally know and worked with those 4 officers involved in that shooting. 3 of them being current members and were current members at that time of the Rutland City Police Department. A couple of them I knew pretty well. And the fourth, one former officer who is now employed in Rutland Town. And this incident occurred when your member, Senator Terenzini, was chair of that select board. So he too knows this incident well. Okay, back to the beginning. You know, when 8 years prior to the tragedy, I realized Christopher was struggling with a substance abuse challenge, a real problem. I developed, as I tend to do sometimes, a strategy of the best way I knew how and confronted him in a very supportive but direct way. I came up with a mantra, and that mantra was, I love you, I'm worried about you, I want you to be healthy and happy, are you ready to get help? And of course, like any young man in denial, he's like, I don't know what you're talking about, Pop, just, there's nothing. And I kept asking that same question over and over again. And it transitioned from, I don't know what you're talking about, there's nothing going on, to, hey, Dad, I'm fine, to, no, I'm not. And then finally, you know, I asked, I love you, I'm worried about you, I want you to be healthy and happy, are you ready to get help? And one day he said, no, Dad, but don't give up on me. I want to believe that I didn't give up on him. And after that event in October of 19, you know, and overlaying our family's pain, our hurt, and our grief, daily I still wrestle with guilt. I wrestle with self-doubt. And I wrestle with the question of whether or not I had done enough and had done the right things. Frankly, I'm fortunate. I've been allowed to unpack these feelings and allowed to unpack my response to this event through what I qualify as the gold standard of counseling in Vermont, Lori Gurney. She coincidentally helped in the drafting of the legislation in front of you, S42. And she also coincidentally works very closely with law enforcement officers who are involved in traumatic events. So please, let me be clear. In my professional and personal experience, our first responders and dispatchers not only deserve or need, but they must be entitled to the best treatment available for the incidents they encounter day in and day out, and not just for these one-time tragedies. The body of evidence is irrefutable. People much smarter than I can speak to the clear, unambiguous, and significant number of peer-reviewed academic studies that reflect the deleterious effects of untreated trauma, not only for the individual, but for the communities in the event of law enforcement officers or other first responders, the communities they serve when their untreated behaviors result in further harm. So I implore you to not only pass this bill, which establishes the Wellness Commission, but when those commission's recommendations get tacked on to your wall in subsequent legislative sessions, take them off the wall. Support the first responders and dispatchers, law enforcement officers, firefighters, emergency management technicians, and again, as I said, dispatchers who are too often forgotten. And whether it's, as I said, an LEO involved in a shooting, could be a firefighter who pulls a buddy out of a burned home, an EMT who responds to a double fatal, an accident with kids, they're likely to be looking for support after the Wellness Commission does its good work, and they'll need resources, support, further legislation. Please heed their requests. And lastly, I'd like to briefly segue into, another hat, just being thrown back to a former policymaker and also someone who spent 2 years in purgatory up there under the Golden Dome in the House before before I went on to do other things. Individuals and colleagues within the State House, as well as other stakeholders, may say to you, hey, what about the victims? And they'd be right. What about those who suffer trauma due to the actions of LEOs, law enforcement officers, and other first responders? My response to that is support them as well. And I can only speak to the victims advocates in the state who are trained, who are top-notch individuals who can provide guidance to victims' families who may otherwise be lost in the shuffle. And, I do need to, in this forum, call out the Vermont State Police victims advocate, Katie Brayton, who worked with me and my family, almost a year and a half ago. So that's all I've got. I can take questions. As I said, I'm here wearing 3 hats, and there always are the right choices that are hard to make. And one of those is ensuring, as I did after working with Chief Colonel Interim Commissioner Baker, or whatever hat title he's wearing right now, in this instance for S42, the real force behind the legislation, find the resources to help out our first responders. They will need your support. And as I said, I've been fortunate to find the support, and this commission is a much needed first step in ensuring that they can unpack their feelings and they can deal with their trauma so they can continue to serve at the highest professional level the communities in which they live and work. So that's
Chris,
all I got for you.
That's not all. That's a lot. Yeah, thank you. And this is, I'm sure it's still a difficult story to tell, and many of us have
Madam
been
Senator,
aware. What?
Madam Chairman, it's the first time I've told it.
Oh, thank you. Thank you very much.
Yep.
For that.
So I apologize. I get, my wife beats me up all the time. She's the table giving me support. Now I interrupted you and I apologize. So
No,
go ahead, please.
I'm used to it. I just wanted to say thank you, very sincerely. Thank you. We've all been aware of the situation that you went through, but had no idea about the details that you shared with us, and the obvious depth of emotion that you carry. And all I can say is we offer our full support for your continued wellness. And thank you for bringing your words of support for our first frontline responders.
And, just let me offer up to you as a committee of jurisdiction. If at any time during this process, as I've told my buddy Baker, if at any time during this process, whether it's in the Senate or the House, if you feel there's any value I bring to the conversation to other stakeholders or your colleagues, please don't hesitate to call on me. This is important.
Well, and your strength is clear. And so we will do that. Thank you.
All right.
The one good thing, I just want to say, one good thing that you said was that the House was purgatory, but you didn't include the Senate in that.
Well, there you go. I appreciate that. So Senator Terenzini, Senator Hooker, Senator Hardy, nice to meet you. Katie, good luck.
I think we might have a question.
Yes, absolutely.
So, Senator Terenzini had his hand up.
I thought he was waving to me.
Yeah. Thank you, Senator Lyons. And Chris, thanks for being here. I mean, that testimony goes without saying how powerful it was. And no question for me, just a thanks for being here, and a statement that in my early opinion here as a freshman senator, I don't think there could be more important legislation that I could be a part of advancing this session. So And I'm sure I speak for many of my colleagues. This is imperative for the mental health of our first responders who deserve these great resources. So thank you for being here.
All right. Thanks a bunch, folks. I appreciate your time and your flexibility again.
Thank you.
All right. Bye-bye, Nellie. Thanks for keeping me straight.
Take care.
Bye-bye.
We'll see you. Okay, I didn't see any other hands up, and so we'll move on. And that Cheryl, Senator Hooker, thank you for the suggestion that Chris Louris might be available for testimony. It obviously is not easy.
He's amazing.
Yes, very much so. And I've known him a long time. Our relationship goes back to select board chair work together and then Senate work together. So he's contributed a great deal to the state as well as his own area.
And I just want to say his non-inclusion of the Senate in purgatory might be because he's never served.
Wait, be careful what you say. You're on YouTube. Katie, thank you for being here. I see that we have a new draft that you worked on with Senator Hardy. And I think we have enough time to scoot through it a little bit, and then we'll be coming back to it on Friday. So let's do that.
Sure. Katie McGlynn, Office of Legislative Counsel. I don't think I've ever had to follow harder testimony, but I will share my screen now and I'll pull up the document. Do you see F42?
That's good.
You see it, great. So one thing that got lost in the editing process was the highlighted changes, but I will scroll through the document and I'll let you know where those changes are. So
And
the first change.
The highlights do show up on our iPads.
Oh, okay, great.
Wait, Katie, which one are you looking at? The amendment or the bill? Because the highlight.
Oh, I pulled it up from the website. I have the bill. That's why I'm having a problem.
No, we need the
All right,
amendment.
you're right. Let
because
me
it's
stop
got
sharing.
all the changes we wanted.
Let me see.
The amendment is now on the website too, Katie.
It is. Okay, great. Thank you.
Yep. Draft 1.2.
Oh, great. Okay. And that explains why I didn't have, why I
So
lost the highlighting. So there we go.
Right.
Okay. Are we all looking at the amendment?
Yes, ma'am, and we can see the yellow.
All right. Okay. So S42, this is a strike all amendment. So it contains the whole text of the bill as introduced and just the changes are highlighted. So first there was a change in this subdivision 2C with regard to the Vermont Criminal Justice Council. It used to be the Training Council. So that name has been updated. And then we get to the list of the responsibilities of the Wellness Commission, and there were a few changes here. In subdivision 4, there's a technical change that you can't see because it was a deletion. So at the very end of this phrase, trauma experienced by emergency service providers, it had also said in law enforcement officers, but since the definition of emergency service providers includes law enforcement officers, that language was removed in subdivision 4. In subdivision 5, this language captures the idea that family members also experience trauma, not just the emergency service providers. So the new language reads, to identify gaps and strengths in Vermont's system of care for both emergency service providers who have experienced trauma and their immediate family members to ensure access to support and resources that address the impacts of primary and secondary trauma.
And, you know, it's interesting because this was a suggestion that came to us when we stopped after we worked on the bill. So, and then Senator Hardy also brought it up. So it's good to include it.
There's another change in the duties of the commission. That's a new duty, subdivision D, 10, to identify the unique needs of and develop culturally appropriate services for emergency service providers who identify as women or as Black, Indigenous, or persons of color, or both, and who have experienced trauma in the course of their duties. Similar to that concept, when we get to the membership of the commission, the new language highlighted in yellow specifies that the members shall include representation by individuals who identify as women or as Black, Indigenous, or persons of color, or both. And then we get into the list of members. You'll see we have the same change in subdivision C1B that we had on page 1 or 2, which is updating the title of the Vermont Criminal Justice Council. And the last change is a new member of the commission. I'll scroll down here. We have a new subdivision X, the executive director of the Enhanced 911 Board or designee. So those are the changes. I'll stop share so you can see each other.
I think we talked about each one of those as we went through the testimony, and thank you, Senator Hardy, for taking the lead to put this together with Katie. And I think the folks who have been most involved with this bill have also looked at it. I haven't heard that there's any disagreement around the language. So my suggestion for us, and because I want, and Senator Cummings should also be here. She had a very strong investment in this bill as well. So my suggestion is that we look at this language. Are there any questions right off the bat? Do you have any for Katie on the language that's there that seem okay? And what we'll do is we'll circle back to this on Friday. We have some time scheduled. And, you know, who knows? We might be able to put our clerk to work for the first time and have a vote. And we'll see how that goes.
I'm going to have to get with Nellie, Senator Lyons, and she's going to give me a quick lesson on my job.
You're clerking. Okay, that's good. Oh, I don't know that you're going to need your hand held too much. So the question I have is, Katie, as we look at this, this will be a proposal from the committee for a strike all amendment on S42, and that would be for whoever presents the bill on the floor would present it on behalf of the committee. Is that how it goes?
I can update that when I have to correct that one typo. So when I do that, I'll have the
All
amendment
right.
be
Yeah. So
offered by
we'll
the
talk
committee.
about. Yeah. Okay. Good. I'm sorry for interrupting. We'll talk about that on Friday.
Senator Lyons.
Already had a comment.
I just wanted to say that when Katie drafted this, she asked me whether it should be drafted as a committee amendment or from me. And I said I wasn't sure where the committee was at. So that's why it just has me on it at this moment. But if everyone is in agreement, it should definitely be a committee amendment.
Yeah, no, it should be a committee amendment. I think because it has a lot of the elements of the changes that we had talked about, plus the equality issue. So yes, it's, and then we'll that's fine. Don't worry about that. That's not a big deal.
Okay. And I just had one more comment. I just think that Chris Loris's testimony really underscores the need to include family, because clearly the trauma is more than just impacting the person on the front lines, but also their family members. So that was great to receive that testimony, and incredibly powerful.
Totally powerful.
Yeah. And Katie, thanks for all of your work on this amendment and the bill.
All right. So Katie, we'll look at the small correction that you're making, and then we'll go through the bill on Friday, and then we can make a decision about how to proceed. Senator Cummings was not able to be here this morning, but we'll but we'll loop her in on that as well. So is there anything else, Katie, that you wanted to add to this?
Oh, not for me.
Okay. I think I'm going to need a real quiet time after that testimony. That was so powerful. So powerful. Oh, okay. And I will tell you that there was other testimony that we had last year that was, as I would say, very compelling, perhaps in a different way, when we heard from a state trooper who was very close to committing suicide and utilized counseling available. There was another person who, as an EMT, was working. I can't believe how hard she was working. It was, 24/7 with folks. And I can only imagine what the stress is right now with COVID. So this bill is, it's a little bill, but it is going to be, let's hope it is significant in people's lives and it does help people. And let's also hope that I take the words of Chris Loris very seriously about having a continuing eye on the recommendations that come to us. As I said a while ago, I mean, we talked about how important volunteers are in our state, and a lot of our EMTs are that. And we need to support them. So anyway, we're over time. This is a bad thing. Anything else? I'll see you all tomorrow morning at 9. And thanks for your patience. And thanks again, Ruth.